So what are the things that will tell us that you're happy? So that then the client would be able to think in terms of behavior. So in cognitive behavior, we usually say we transform the feeling and thoughts to behavior. So we may focus on the behavior parts. So here, when the client says, I'll be feeling happy, you're saying that, all right, then tell me, what are the things that you will be doing that will tell us that you're happy? Suppose if the client said, I won't be having this negative thoughts anymore, or I won't be having this distressing thoughts anymore. When the client is saying that, your job is to come up with the question, oh, really? That's nice. So you are saying that our conversation will help you to stop this distressing thoughts. Am I right? Yes. Great. Suppose you don't have any of this distressing thought, then how it would look like? I'll be cool. Okay. Can you tell me what do you mean by saying what's cool for you? Can you tell me something more about that? Or you can also ask, suppose if you're cool, what are the things that you will be doing to say that you are cool? So the question is not what are the things that you will be doing to become cool. That's wrong question. What the question is not what are the things that you will be doing to become happy. No, that's not the question. The question would be, first question should be how it would look like if you are cool, how it would look like if you're happy. So if you're getting an end picture, then the client will be able to tell you the details of the means. So the goals are the very important thing. If you can elicit the picture of the goal, then automatically the client will be able to give you details about the means, how he can reach that particular goal. So if I'm bringing back your attention to the taxi driver metaphor, if you got into the taxi and for example, if you're booking a cab online, Uber or something, they first they will ask you where are you right now, and then they will ask you where do you want to go. And if you're not able to give you an endpoint, you won't be able to book the cab. So similarly, if suppose if you booked, then you will get the routes. These are the routes that you have to go. Similarly, when you get a client, if you can help the client to get a picture about their outcome of the therapy or the preferred future, then they'll be able to find out the steps, routes, means that they have to follow. Okay. So this is the first phase of the conversation that would take around 15 minutes. I'm recapping once again. You are asking about what are the content for the conversation by asking what made you be here. Second thing, you are developing the goal for the conversation. The goal is like the usual question would be, suppose our conversation is really helping you, then how it would look like. Or the question can be, suppose our conversation went well, and if you really got what you need from our conversation, then how it would look like. You can also replace the word conversation with counseling and psychotherapy. Suppose our therapy session went well, and if you really got what you need from our therapy sessions, then how it would look like. Suppose our counseling went well, and if you really got what you need from our counseling, then how it would look like. So you can use, I usually use the word conversation. I usually use the words that the client use. If the client is bringing the word counseling, then I'll be using the same word. If the client is bringing the therapy, then I'll be using the same. So at times I take some time to explain what is talk therapy and how does it work and how it's different from the other models of conversation. All right. So this is the first. Then in the second phase, which is very important in Solution Foxby, we usually use scaling questions. And the scaling question would help the client to understand where I am right now, how far I have already moved towards my preferred future, and how long I have to move again to reach my preferred future. So usually scaling question is like this. If 0 is your worst state and 10 is your best state, where do you stand in between 0 and 10 today? Okay. So if you really want to use it in the client's own terms like this, the question was, what made you be here? I'm having all negative thoughts and worries about whether I'll be able to pass, I'll be able to complete my course, whether I'll be getting some job. So I'm feeling like I'm hopeless. Okay. And you have developed some goals for the therapist. Suppose our conversation is really helping that out, that I'll be able to prepare for my exam. I'll be doing what I need to do. I'll be reading, I'll be going to my class regularly, I'll be attending my tuitions, etc. So wow, this is nice. And actually that's incomplete. So you would be one more question would be needed for that. Suppose you are able to write your exam, suppose you are able to preparing your exam, you are doing everything, then what difference will that make in your life? Then I'll be so. This is very important. And when you put these things into the scaling question, it would be like this. 10 is like you are able to, do your exam well. You are preparing for your exam. You are attending your classes. You are attending your tuition sessions and everything. And you can say you're at 10. Zero is like you're just opposite. Not even you are not even able to make a conversation with me. You are not in a state that you need to think about you have to come out from this problem. Zero is that much worse. So where are you right now between 0 and 10 today? And often the client said, I'm at 1, I'm at 2, I'm at 3, I'm at 4, I'm at 5. All right. So when the client say I'm at 2, or when the client say I'm at 3, your job is to invite the client's attention to look into what the you are at 2 not being in, sorry, what made you say you are at 3 not being in 2 and 1? So I'm repeating the question. If 0 is the worst state and 10 is the best state, where do you stand in between 0 and 10? You can use their own words and language to describe 10 and 0. 0, you can say just opposite of 10, and not even like this, even worse. That means you are at not a 0 and you are not at 10 right now. Okay, so it's something between 0 and 10. So if the client said I'm at 2 on the scale, then you check with the client. Oh, really? So can you tell me what made you say you are at 2, not in 1 and 0? Yeah, because I am talking to you, because I think I need to develop. Wow. What else? Maybe because I'm looking into my syllabus. At least I'm searching what I have to study. Sometimes I have made a phone call to my friend to see whether she have some materials for studying. Oh, really? How did you do that? So the question, how did you do that, doesn't mean that the client is going to tell you something, but instead the question indicates that you have did something right. And rather than saying that you have did something right, the change will be more when you put it as a question. Wow, how did you do that? So the client would feel like, I did something right. And the question may also invite the client to think about if there is something, some skills or resources, or some resources the client have already used to elicit more about that. So and then the question would be, suppose if you're at 10, then how it would look like, eliciting more details about the preferred future. Suppose if you're at 10, who among your family members will be acknowledging you that you are at 10, witnessing you that you are at 10? Or my parents. Okay, what they will be saying after seeing this issue. So when the client is able to picturize their preferred future and elaborate in as many details as possible, and it helps the client to bring a lot of components that may help the client to move towards it, or we call it as resources. Okay, and when the client say I'm at 3, you can also check with the client. Oh, all right. So you're at 3 right now. Okay, and you said this is the picture that you will be at 10. Was there any time in your life where you were above 3 on the scale? Sometimes the client said no, there won't be any time. Oh, then don't discard the question, instead check with the client. All right, so you're saying there's a divorce. So I assume that there could be some time that you felt like at least a little bit about 3 some days maybe. Yes, some days it was. Because often the client, they have paid much attention to the wrong time rather than the right time. If you look into our own life, if I'm asking this participant, I have 88 participants right now. So if I'm asking you, so if you look into the last 30 days of your life and bring with us with a time that you felt like, wow, this rise, you will be able to do that. But you will be able to do more quickly if I ask this question. Can you look back the last 30 days of your life and bring back a time that you felt like, this is really bad? Okay. Oh, so you will be able to recall that second question more in a quick manner than the first question, because we have paid much attention to our wrong time or the distress or the problems rather than the good time. Okay, so we call it as inattentional blindness. We pay much attention to what's wrong with us, and it often almost all the clients who are visiting us might have paid much attention to what's wrong. They will be preparing, they'll sometimes they make lists. This is what I have to say, this is what I have to do, and they're coming to our sessions. And if you ask this question, was there any time you were not having these problems in your life? And they need more time to think about it. You have to wait for the answers. And when you get an answer and check for the resources, how did you do that? How did you decided to do that? How did you manage to do that? So you will get a lot of skills and resources the client have used, and you can keep it as as in a, like, you will keep it to make the client to move towards the preferred future. And after listening to all these answers, you would hint the client that you are going to end the session in 1 or 2 questions. For example, I usually check with the client. So we have been talking for around 30 minutes, 35 minutes, 40 minutes. So I'm wondering, is there any question I love to ask you? Is there anything I love to ask you? And the client would give you an answer. For, yeah, Jesse, you haven't asked me you haven't asked what's my problem. Oh, really? So let me ask you, what's your problem? Sometimes the clients say, no, I think I have already got what you need to do. I'm sorry, but I thought you forgot about the question. No, I said, no, I didn't forget the question, but so it's okay. Sometimes the client say, yes, shall I go with that question? And the client say, yes. And if you are getting an answer like, Jassim, tell me what I have to do now, then that's an indication that the conversation that you had in the last 40 minutes or 35 minutes wasn't much useful for the client. That means the client really didn't get good idea what they have to do in their life after the conversation. Instead, they are really waiting for your advice to give. So if you are getting a question, when you ask, what is there anything I left to ask you? Yeah, Jassim, you didn't tell me what I have to do now. Oh, I'm very sorry to know that. Oh, okay. So if you really want to give some advice, then elicit from the clients on verbatim. You check with the client. Oh, okay. So can I ask you one more question, please? Yeah. Suppose if I'm giving you an advice and it seems like the advice is really working for you and it really helped you, then how it would look like? If your advice would, then I'll be able to come out from this problem. Okay, suppose if you come out from this problem, who will be the first person to notice that you have come out from this problem? Maybe my friend. Okay, he or she, it's a he. Okay, so what he will be noticing first so that he can say you have come out from the problem? Maybe if I am not sleeping in my class, or maybe if I am attending my class properly. Wow, wow, great. And what he'll be, so you are developing an advice for your client from the verbatim of the client in themselves, you not being in an expert position. Okay, so towards end of the conversation, and if the client still needs something more, you can check with the, is that okay, we can talk and I don't get into these questions usually, that you have forgot to ask what's the problem, or I usually get an answer like, no, I think we have covered everything, we have covered most of the things. So I usually get an answer like this. And then you check with the client that suppose if you are meeting again in 1 week, and if you have made a minute progress from 3, then how much it will be? So you have given a time frame 1 week, and if the client is saying, giving you you are asking for a figure on the scale between 0 and 10, and if the client is saying that I'll be at 4, maybe 4, and the question is not about what will you do to move from 3 to 4. No, the question is all about how it would look like if you're at 4 on the scale. Number one, then the client would be able to get an idea about what they have to do. If I'm at 4 on the scale, maybe at least I will, I will attend my class. I mean, I will just go to my college, or I'll just attend my online sessions. All right, all right. So can you tell me where you will be, from where you will be doing it? From my own. All right, and who will be noticing this in you? Okay, so you are picturizing that minute change, not about the whole change, but the minute change, at least attending, not about taking notes, not about answering question, not about writing exam. So you're making minimum possible goals, the goal that the client can do in 1 week. So you always focus on the small change, and it would take help the client to make a larger change. Sorry. Give me 1 minute. Sorry. So focusing on the small change would help the client to bring back their anxiety less. They will be able to focus on something. They will be able to feel like I can do that. Confidence, and they will end up in doing that. So that will help the client to bring an upward spiral rather than the downward spiral. That I won't be able to, they will be able to come out from the negative vicious cycle. I'm sorry. Okay. And then you end the session by saying that I have a homework for you. Okay. So eliciting the data. So before you giving the homework, I usually ask one more question. Okay, so after this meeting, suppose if you're leaving this room, or if it's an online session after this meeting, and if you have made a decision to move from 3 to 4, so what will be the first thing that you will be doing that could tell us that you have made a decision to move from 3 to 4 on the scale? And the client would say, maybe after this meeting, then I'll be talking to one of my friend and I'll collect some notes from him and I'll be doing it. Great. And when I come back after 1 week, I'll be asking you one question. What's better? Number one, what's better? And number two, you focus on the things that you have been doing from now to give me one moment. Sorry. So I usually give this homework. This is very important. We do that in the other model. We ask the client to focus on what's wrong. Instead, we ask the client to focus on, suppose if you are meeting again in 1 week, and if you have made a minute progress from, if you are meeting again, and you let me know the things happened in your life, which you would like to happen in the same way again and again. I remember one of my clients when they brought the kid to me and the parents were talking about what's wrong with this kid. And I was trying to make a conversation with the kid and he was not really responding to my questions. And I asked the kid to stay outside and I was making a conversation with the parents inside my room. I asked them, when you come back after 1 week, you focus on this kid. Okay, from today onwards, I don't want anything that happened in the last week or last month or anything. I want you to observe your kid from today onwards. And when you come back after 1 week, you let me know what your kid is good at. So what are the things that he have done nicely? What are the things that he have done in a manner that can be appreciated? Okay, I don't want anything that happened in the last week or anything. And I won't be asking anything else from you, and this is what very important and I really need this. So each day you observe him and not make a note on it and you come back. And when they came back, I asked them, what's your kid good at? And the parents were talking about, he is a nice lad, he's done that, he's doing that. And the kid really surprised, oh my god, what happened to my parents? I never heard like this before. And in the third session, the kid asked me, what did you do to my parents? Okay, did you say something to? No, I said no. So when you get problems of the kid and when the parents are really focusing on what's wrong with my kid, if you can help them. So similarly, when you ask the client, when you come back after 1 week, you let me know the things happen with you, which you would like to happen the same way again and again. It's very important. So that's a homework for the client, and he will get busy in looking into what's right with me rather than what's wrong with me. And that helps the client to, bring himself or herself out of the negative vicious cycle and end up in doing things that they really need to do in their life and make the progress. So this is the first session protocol. And when the client comes for the second session, we usually initiate the conversation after making a brief conversation. Hi, please be seated. Brief mental state examination, and then we should, what's better with you? And you will get 3 kind of an answer. I'm better, I'm really nice and better. So the first type of answer is yes, positive response. I'm better for the little or the large change or a minute change. The second type of answer could be no change, I'm in the same state. The third type of answer can be I'm in my worst state. So the first type answer is the best answer. Maybe when the client say, yeah, I'm fine, I'm better. Wow, how did you do that? So you are focusing the client's attention to themselves. They have did something and that helped them to make the change. And how did you do that? Oh yeah, I'm taking medicines. Wow. So what else you did to make this change? maybe I was, so he may be or she may be thinking about something that they have did for themselves to make the change. Or if the client is saying that no, it's all about the medicine that I'm taking. Oh, really? So I have a question for you. Suppose if we want to convert this change in 100%, how much influence the medicine have? What's the percentage of medicine that influence of medicine to make this change? The client said 95%. All right, that's really nice. I should really appreciate you to do that. Can you tell me what's that in the 5%? So you are redirecting the client attention to themselves, some resources the client have used for themselves. And if the client is saying that there is no change, I'm maintaining the same state. Oh, really? Okay. So can you tell me how have you managed the situations to be stable like this and maintain the status quo, not getting worse? How did you do that? Maybe I'm taking medicines or I'm doing that, I'm doing this, okay, whatever. And if the client is saying that I am in my worst state, and the question would be, oh, really? I'm really sorry to know that. Uh, can you tell me how have you managed these difficult situations? So the all the attention should be focusing either on the change that the client have elicited or the coping strategies the client have used to get rid of the most worst state or maintain the status quo. And if the client is talking about something problem, you listen to them very carefully with a solution focus here and come up with a question. So the next question after eliciting all these details, so if 0 is your worst state and 10 is your best state, where do you stand in between 0 and 10 today? If the client have elicited already made a change, then they would say I'm at 4 or I'm at 3.5, or I'm at, if the client is maintaining a status quo, then they would say I'm at 3. If they got worse, they would say I'm at 2, 1 or 0. Or if they're and then you progress, you make the conversation from that particular. The client said I'm at 3, same stage, then how have you managed the same situation not getting worse? And if the client say I'm at 2, I'm worse, and how have you managed this tough situations, and get an answer, and then you progress, you elicit the next week change. Suppose if you're meeting again in 1 week, and if you have made a minor progress on the scale, maybe how much it will be. So you can also give a point and a time frequency like this. So suppose if you're meeting again in 1 week, and if you have made a manual progress from 3 to 4, then how it would look like. So these are the patterns or the protocol, session protocol that we usually follow in solution focused brief therapy. And there could be many questions then how it's possible, how it works, but it works. There are many meta-analyses, many randomized controlled trials on many different types of clinical population, which illustrates that solution-focused brief therapy works similarly as cognitive behavior therapy and many other therapeutic models, or better. And it is more brief than the other therapies. It consumes less time than the other therapeutic methods. Okay, there is a lot of research on the outcome, and there are a few process research too, including my work, which I have been doing in the cognitive components. What are the cognitive changes that the therapy makes in the client? And there are some other future works which is happening in US and also in with me, which is on EEG. What are the electrical changes, changes in the brain that we can elicit after when the client is trying to respond to these questions. And both process research and outcome research illustrates that solution focused brief therapy is effective and it makes changes in the client. So all the issues would be transforming from a medical model, a traditional model, to a solution focused model, where we focus more into the symptoms and the developments, right, instead of that focusing on the preferred future and the resources of the client and making a conversation. So asking questions, eliciting an answer, and from the answer we are asking the next question. Again, we are getting an answer. From the answer we are asking the next question. It's a turn-taking process. We are co-creating a preferred future for the client. And by the end of the conversation, if you really did a good interview, you as a therapist and the client will get a good idea on what they have to do to come out from this problem. So that's all for today. Thank you very much. I'll just show my slides if you for more clarity. All right. So this is the first session protocol that we have discussed. So developing opening and problem-free conversation, you inviting the person to describe the problem, and you get a role clarity whether the client have come by themselves or they have come by for someone else. And at times you will get clients saying that I don't have any problem is all with my husband, problem is all with my teacher. So the question would be, how could you, so suppose if you're making conversation, do you think that they'll be having any change in their problem? So you make a role clarity and form goals and use scaling questions and facilitate change by resource activation. If you couldn't activate the resources, you won't be getting real good access for the change question. Okay, highlighting the focus. And then you give a feedback by asking, you can use what is there anything I left to ask you, and then you check with what we have discussed so far and what are the resources. You can give compliments to your client and the change activation question and end. And in the follow-up session, you can listen to what's better, look for exceptions where the problems are not happening, or how the client have managed the issues so far, and elicit and amplify more changes, reinforce the attempts, no matter whether it was successful or not. You can amplify all the attempts, you can compliment all the attempts that the client, you can refer to the Carol Dweck's growth mindset theory, how attempts, how reinforcing the attempt would make a difference in the clients. And you highlight the change, give feedback, and again the same pattern that we have followed in the first session, and end with a warning. Thank you very much.
Thank you. It's been wonderful.
One of the best sessions, I'd say. Over to chairpersons.
Thank you, sir. Really an amazing session, and sir has dealt everything in a very pragmatic way, and sir has explained what is the real life challenges that is one finds when it is in the when we are doing the clinical practice. So thanks a lot, sir.
I'll also like to thank Dr. Jasim for a lucid session, and thank you for sharing the intricacies from your clinical experience with patients, and telling us how to approach such things in a very, very positive way, and leading the patient or the client to a path of discovering his own solutions. So I would like the moderators to take up the questions, please.
Yeah, I think there are many good wishes, and I think those are very appropriate. Jasim, where were you till now? You are a late find for us. We found a hidden gem in you. Congrats on the very excellent session. First, my question: how would you like to see us after this session? What should we have learned? What are the improvements? So I am directing your question at you.
Okay. So to Jasim, to add to Dr. Aleem's question, will I be wrong if I am saying that he's asking you a miracle question?
So I skipped the miracle question in terms of like a miracle question actually, because I am not using that miracle question as it is nowadays. Instead, I'm using the scaling question and asking the client, suppose if you're at 10, then how it would look like. Suppose all of a sudden you became you feel like you're at 10 on the scale, then who else will notice? What will be the first thing that you will notice? So thank you very much, Dr. Anil, for bringing it. Yeah.
But you really did touch upon that part also, by talking about the preferred the outcome.
Yeah.
So please answer Dr. Aleem's question. How would you like all of us to be after this session?
Okay, so it's a question. So let me answer this question with a question. Suppose you really got a really nice answer from you, and it seems like it was really working for you. Then how it would look like?
Yeah, I would feel brilliant, and I would feel like I'm helping my patients more.
Great. Okay. Great.
So Jasim, what I can pick up, or what I can summarize in my mind is you're trying to shift the focus to the solution, talking less about the problem, talking about the problem just enough to gather the data, and then shifting the focus to what are the possible futures, what are the best outcomes, better outcomes, and slowly trying to take the patient from to the better outcomes. I think
So, so actually we need less sessions.
Yes, sir. We meta-analysis says that 4.5 sessions.
yeah, actually that is Amrit, I fully agree with you. What I could gather, in less sessions we can do more intervention as per the today's presentation.
And
Amrit,
there is less, blame game. Like you didn't do your homework well, you didn't do this, you didn't
Yes, sir. Yes, sir.
everything is amplified and you are given credit. That's the best part.
Yes,
A
sir.
depressed patient is not to made to feel more guilty for his illness. That is, I know we
Absolutely.
follow it in our
Absolutely.
practice also. We have an interesting person.
Because they didn't do the homework.
Yeah, that's one thing we face. The therapist comes and tells us, sir, he's not following what I've told. He's not, he didn't do, he will not improve because he's not doing, there's a conflict. We already know that somebody is down. So
Yes.
we have one question from Dr. Dushad, sir. He all the way from the Middle East. Dushad boss, you've raised your hands.
Sir, I just want to know, this is a new topic for me. I just want to know how it is different from problem solving strategy. Is it the same or it is different?
In problem, I'm not an expert to talk about the problem strategy method, but as far as I understand, we don't focus on the problem and to fix it. Rather that we develop, we build solutions which will be different from whatever the client have described. So the basic assumption would be there won't be any direct relationship with the problem and the solution. When the client is describing a particular situation and the problem description, when towards the end of the conversation, you can see the client is coming up with something very different, which may not be directly related to the description of the problem.
Dr. Tushar, this is Dr. Anil Nischal. Add to what Dr. Jasdeep said. Problem solving actually involves finding the problem and possible solutions and implementing them one by one. While this solution focused therapy, as we have learned today from Dr. Jasdeep, a different kind of approach focused totally towards the positive side and bringing out the good in the patient and for the client and on a path encouraging and that is what I think. Problem solving is a list.
sir, I think we missed some of the parts of your question, your comment. It was not audible.
Not audible.
Okay, right. Am I audible now?
Yes, sir. Yes, sir. Now.
Okay. So to answer Dr. Tushad's question and to add to what Dr. Jasdeep was, problem solving is a different approach that involves defining the problem, then having a list of possible options for solutions, listing them in order of hierarchy, in which the first one might be the best solution, second, third, fourth, and then implementing the first one, which is sort of expected to have the best outcome. If you do not get the problem sorted out with that, you move to the second one. So that is focused on defining the problem and finding a solution. But here, Dr. Jasdeep's approach of solution focused therapy is more about bringing about the good in the patient and taking him very positively on a way of self-discovering his own solutions. That is the difference.
Exactly. Agree, sir. Agreed. And Jasdeep, regarding this, suppose there are past events, there is trauma in the past, there is grief. So is this solution focused therapy working well there or not suited for there?
It's working well.
Okay.
So I had a client, she lost her daughter, 19-year-old daughter.
Right.
Daughter committed suicide. And she had developed this, she came to me after 6 months, I guess, after 6 months, and she was already on medication. and she had this flashbacks, memories, and fainting like feelings and everything. And she initially, I didn't know that this happened. I had the case history in front of me, and they started, my conversation went on. And in the second session, she stated that this happened. And before second session, I got to know that this happened because of I was having the detailed case history. And but initially she didn't liked, and she mentioned, I don't like people asking me what happened. So at times, and I had one other client the girl was molested. And in the third session, she said, Jassim, if you were asking me what happened, I might not have come to you. So at times the people don't prefer talking about it. And if the client is talking about it, I listen to them, but I don't probe or encourage to talk more details about it. Rather, I listen to them, acknowledge, accept, and empathize, and then go to the next.
Then how you put this question, that the standard question that we're talking about, how do you like to see yourself in the future? And so
the basic question would be, what made you be here? And this lady answered me, I'm not able, she's running a computer center, I'm not able to go to my computer center, I don't feel like, and sometimes I'm getting this, negative thoughts and memories, and I really want to know. So all these descriptions had been given in the first session, and I asked her, suppose our conversation is really helping you, then how it would look like. So I'll be going to my computer center without my husband's support, I'll be driving my scooty myself, I'll be going to bank, I'll be doing my household work, I not be depending upon my sisters to do my household work. If this is happening, then I think that would help me. And this was descriptions that gave me. And this was the functional impairment that she's having right now because of these issues. So rather than looking into what happened and what are the causative factor of these impairments, we are trying to help the client to bring all these changes that the client would like to have in their life.
Absolutely, fully agree. Amrit.
So Sazi has asked a very interesting question. So how effective is this would be in personality disorders? So, that's a very important.
Yes, it's a very important question, and often I get to whether this work with borderline personality disorder. Most frequently asked question. And as this is a trans-diagnostic approach, we don't. This conversation is not focusing on fixing the personality issue, rather than the here and now reality, the impairment the client would be having. That means the client may be having a right for even if we have a diagnosis of borderline personality, and if the client is coming with a particular episode of depression or anxiety reaction or whatever, initially we will be focusing on that. Similarly, we will be focusing on what made you think that you need to be here. And if client says that I'm having emotional issues, I'm not fair, the emotional variations of my emotions, and at times relationship problems, or sometimes I feel like cutting my vein, or at times I feel like I'm not good for nothing, I'm alone. So we focus on what the client is presenting, and we focus on how this is a problem for them, and then we build a particular goal for the therapy conversation, move on. So one of the expert in solution for speech therapy, I think Steve answered this question when somebody's, I have are meeting the person, not the problem. So diagnosis may not be, but for the research purpose and for the understanding, I think we should talk about the diagnosis and how it works in particular. We don't have much outcome research in personality disorder right now. There are a few large projects happening in personality disorder, but whenever I get a personality disorder, I take it into the functional impairment aspects and then focus on the functioning rather than the personality.
Okay.
It has been a very brilliant session. Thank you, Jassim. Keeping on smiling from the beginning till now. And if we extend, I think we'll keep on smiling. Thanks for your smiles.
There are a few questions in the chat box, I think, that need to be addressed.
Yeah.
After using all the questioning technique, if the patient still rates less, maybe 2 or 3 on the scale, then what should we do?
Actually, this is not about the score on the scale. The scaling question usually asked around 25th or 30th minute of the conversation, and it is not necessary. So scaling is not about what happened in the session. Scaling is all about what's the right now situation of the client. For example, if the client come up with a issues of frustration or agitation or distress, I'm not feeling happy, the 30 minutes of the conversation will not make any change immediately. We are asking for the last 1 or 2 days or last 1 week, where do you stand in between 0 and 10? It's not about after the 20 minutes of conversation. And when the client come for the next session, and if the client is saying that I'm still at the same level 3 on the scale, so the focus would be what happened, the focus would not be what happened you to not to make any change. Rather, the focus would be what helped you to be at 3 itself, not being in 2 and 1. I suppose if the client say I'm at 2 in the second session, 1 point less, that means the client is much worse. And the question would not be what are the things that made you to be at 2, not in 3. Instead, how have you managed your difficult situation? And even after 1 week of therapy session, if it seems like not helping until you decided to come back, I should really appreciate you for that. How did you do that?
I think that's a very interesting suggestion by Sazi actually. Can we have a session with him with role play? And then maybe we can address a lot of, he's been speaking non-stop for the last 1.5 hours, and it's, he has taken 4 drinks today. I think we should give him a break. We should call him again after a few days. We will take a lot of questions. I think he has answered enough questions. It has been a very, very, without a PowerPoint presentation, he was speaking. So it's much tougher. So I think we'll hand it over to the chairpersons and, Tufan sir. Because you will keep on asking questions. You have that. Agar main muh kholne nahi milta hai, you will speak here.
Amrit, it was a wonderful session.
Sir, you are not audible, sir.
I think there is some problem with my net connection, I think. So I would like to thank Dr. Jassim for such a wonderful presentation. And if I am I audible, Amrit?
Yes, sir.
Yes, you are audible now. Right, audible.
Right. So very nice session, Dr. Jassim, very informative, very enlightening, and it was a beautiful session, and altogether new approach to see things in a very, very different kind of a very positive light. So thank you so much for your presentation. And as Amrit said, it was really nice that it was actually an extempore and coming right from your heart and from your experience. Thanks a lot. So I would hand over the sessions to the moderators and the chairman, sir. Dr. Tufan. Thank you.
Umesh, you wanted to say something?
Yes.
Umesh, unmute.
Umesh,
You're mute, doctor.
You're unmuted.
Acha, okay.
he did double.
Thank you very much, sir. It was really enlightening, and a lot of information we have got. Especially, we want to build the patient's autonomy and providing his own solutions to his own problems. So that is more important that we have learned today. One more important thing is, I hope I understand was a new term that we have understood today. Otherwise, we usually say I understand your problem. So that's another thing which I can take home from today's year. So overall, it was a very thanks a lot.
You're mute.
Over to
You're
you, sir.
muting yourself. Ghar mein
Oh,
ho kya?
sorry.
Are you at home?
Yes, sir.
Say always in the mute mode.
Okay. So thanks a lot, sir. Over to you, sir.
Tufan, sir, your comments.
Okay, thank you very much. This is a very nice, enlightening session. And I sincerely again thank Dr. Jassim, but I have got a small question. A patient comes, a workplace molestation case. And we have got 3 methods of treatment to be given. Trauma-centered psychotherapy, problem-based psychotherapy, and solution-based psychotherapy. And we have to choose one. What are the parameters to choose one for this patient? I have a clinic, we have got experts in all the 3 fields. Suppose, but for who will choose and how will decide which should be given? First, the girl has been molested in workplace, and the proponents of all these 3 schools tell that we can do it. Is there any logic or rational to choose one over the other.
All right. So shall I answer the question, sir?
Yes, sir, my question finishes.
So, if being a solution-focused speech therapist, we don't decide anything in prior what we have to do with our client. So we listen to the client. So number one, what they're bringing in, what made you be here? So they give answer for our question. From the answer, we have to decide whether we have to jump immediately to the goal formulation question like this. Suppose our conversation really helping you, then how it would look like. Or we will decide that we have to listen more. But because if the client is asking us to listen more, then we keep, we use paralinguistic more like, but not leading question more without using more questions to describe more problem. So we get a hint about whether the client is ready to go to the next phase by asking a solution focused question. This is what I do, sir.
Okay, thank you. As Amrit has told, we look forward to you for another role play, and everyone will be interesting by this. And I sincerely thank all the chairpersons or the men behind Torrent Pharma, and there's been a nice meeting. I think we should have had you earlier. So we'll have you again as a sequel to this. Hope you agree. And over to Amrit for further things.
Sir, as they say, better late than never. We got him. That's such an important thing. People get to know about a topic, about a speaker. They hear a fresh man speaking on a fresh topic. It's a different approach, and it's very close to my heart because this is one of the ways I deal with my clients. So I didn't know what is it known as. I didn't know how it is followed, but subconsciously I follow the same route when I so I could relate more to this topic than maybe Alim could.
So how do you scale yourself on a scale of 0 to 10? I think you should come down to 10 now from 11.
No scales, Alim. So thank you, Jasim. You have been wonderful. We have a ever smiling chairperson, Anil sir, always smiling, always bubbly. My close, junior and a friend, Umesh, looking as handsome as I had seen him 7 years back. Well, thank you, everyone. Tufan sir, thank you so much for encouraging us to, call in fresh blood, fresh topics which many of us have never heard. I thought, what is SFBT? So then Alim told me this is this. So that's how we are learning. We are understanding things. And thank you, everyone. Even if it was a Ganesh Chaturthi, people were buying idols and all these things. We had a reasonable more than 120 attended. That's fair enough. I think that's good enough. So thank you for, we couldn't address a lot of questions, but we didn't want to, stretch our speaker too much. So thank you. Meet you again next time. We have an interesting topic. Alim, what is the next week's topic?
Music.
Bhave sir is there.
Oh, Tufan sir has answered it. Music therapy. So we'll
Yeah.
get clear about music therapy. A lot of healing occurs with music, and let's know how it occurs. Thank you so much. Thank you, Torrent. Good night. Happy Ganesh Chaturthi. Thank you so much. Bye-bye.
Good night.